I'm going to go over something today that is the most commented comment on any social media post that we get, which is, why don't you just tell us how to fix it? Well, I do mention getting rid of adhesion, but you have to realize adhesion removal and even recognizing it is super hard. So let's get into the top 6 reasons why you aren't going to fix your own adhesion. Reason number 1, you need to know your anatomy. And not a little bit like this is a shoulder. You need to know anatomical landmarks, you need to know muscles, you need to know what those muscles do, you need to know where the nerves go, you need to know where the tendons are. You need to know, is that something? Is that not something? Anatomy is a large reason why the layperson will not be able to fix their problem. Let's get into number 2 now, shall we? As I just mentioned, it's not just knowing where they are, but feeling where they are. So when you touch those things, do you know what you're touching? What does a nerve feel like when you palpate it? What does a muscle feel like? What does bone feel like? What words would you use to describe those things? Because if you can't associate that with the structure, you don't really know what you're on, and you could be way off of what you should be treating. Next up, we've got anatomy, we've got tissue differentiation, and then you need to know, is this healthy? Because tight doesn't equal adhesion. Tight is its own problem. Adhesion is going to be firm, tender, it's going to have borders, it's not going to move. But recognizing that, hey, this is tension or this is not really the problem here, something else is the problem, is a big deal. So if you're chasing after signal and not the main problem, you're not going to get anywhere, which leads me to the next one of priority. Our job is to find your biggest problem every appointment and fix it. And then your symptoms will change, your things will improve, and things generally get better. Figuring out that priority is paramount to having actual progress. Because as I said, if there's something you're like, this just feels like shit, and this is where your symptom is, but that's not the biggest problem, you will make no progress because your biggest problem needs to be dealt with first. So we've gotten the main things out of the way. Now it comes down to actually treating. So, tension. You need tension at the right depth and direction to peel adhesion away. You need to use all these other things to allow you to realize what is going on. If you don't know that that nerve generally goes that way and the muscle oriented this way, then you don't know how to effectively peel one away from the other. And there are times when during treatment, you're going to pause a certain movement and you're going to start a different movement to gain more tension. Because without that building of tension, you aren't going to get anywhere. And just feeling that can be difficult. And on top of all this, even if you've done all of these things, it's time to train a lot. Because you see, you can do these things once at a seminar. That doesn't mean you're proficient at it. It means you've done them once at a seminar. I have been doing this approach for 9 years, but I haven't been really dedicated to it except for the last 2. And by really dedicated, I mean I spend multiple hours per week just training how to treat. So outside of clinical hours, but actually working on that. We do coaching calls every other week, going over cases and consulting with other docs. And then every other month or so, go down and do an in-person training. Refresh those skills. Clean up little things that I want to get better at. So when you talk to somebody and say, I'm blah, blah, blah certified, and they're like, well, what do you do? Well, I took this thing and I take a refresher every year. That's not enough. This skill you have here, that diminishes. So unless you're actively trying to get better at it, you're not going to improve and you're not going to maintain your skills. And all of these together is a lot of work. It's way, way more work than most people are willing to do to fix the problem, which is why it's much easier if you just come to someone like myself or my colleagues to get your problem sorted out. Because while it's really nice, the internet is a great resource to fix things without paying anybody anything. This is probably not one of those things.